This is an image I have put as first slide so that I can recognize that the PowerPoint is that of appendicular skeleton. The human skeleton is divided into two parts for the sake of making things classified easily. We have the axial skeleton in the midline of the body, and it involves the skull, the mandible, the vertebral column, the ribs, sternum, and lower down the sacrum and the coccyx. The appendicular skeleton is involving the bones of the upper limbs and the lower limbs. Now, the upper limb or the lower limb is not attached directly to the axial skeleton. They are attached by a group of bones called girdles, and the upper limb has its own girdle, and it is called the shoulder girdle, and the lower limb has its own girdle called the pelvic girdle. In this presentation, we are going to address the shoulder girdle and bones of the upper limb. As we go through this PowerPoint presentation and naming different structures of the skeleton, you will realize, if not yet, that anatomy is visual descriptive science. Now, in order to achieve our goal in studying and preparing for the future, here is the starting point. We are at the point of the starting point. Now, you need to study more, expose yourself to images, films, so that the idea is going to get bigger until it shines. And this is the policy to success. This is what we are aiming at. It is not me only, not the university. It is also your family, and most importantly, it is you having a shiny mind. This is our goal, and this is not for us at all.
This is the reason why you are here. You were chosen because you have young, fresh, bright mind. Because what you're going to face in the future, the very near future, is to be prepared to become a doctor. This process is not full of flowers and full of fun. It needs such mind, fresh, young, bright mind. This is an image showing what you are going to face in the future. It needs exercise, it needs lifting weight, but don't worry, you can do it. Thousands of people did it before, and you're going to do it.
There are a few questions and facts that we have to address before getting into the process of discussing the appendicular skeleton. Now, are upper and lower limbs directly related to the axial skeleton? The answer is no, they are not. Now, if they are not connected directly, then they need sets of bones that attach them to the axial skeleton. This set of bones is called a girdle. The upper limb girdle is described as the shoulder girdle, and it is made of two bones. These are the clavicle and the scapula, and we will be addressing these two bones at the beginning of the presentation. Now, the lower limb girdle is called the pelvic girdle, and it is also made of two bones. Here is the first part of the shoulder girdle that connects the upper limb to the axial skeleton, and it is the clavicle, or what is commonly called the collar bone. What do I see in this image? I can see that this bone is transverse, it is curved, and attaches medially to the breastbone or to the sternum, and as it goes laterally, it is attached to the scapula. But is this is a mind map of what? Of the shoulder, or what is called the pectoral girdle. If you follow the lines, it is very easy. Follow the red line, and it addresses the clavicle, and there are a group of basic facts about the clavicle. And you follow down the green line, and it will lead you to the important details, the things that you must know about the scapula. Let us see what we can extract from this image. First of all, here is the lateral end of the clavicle attached to the scapula, and here is the medial end of the clavicle attached to the manubrium sterni, the part of the axial skeleton, part of the thoracic chest wall. What strikes our eyes is that this clavicle is curved, and if you follow this dark black line, you can see that it is anteriorly convex and posteriorly concave. And if you follow the curve laterally, you can see that it is concave anteriorly and convex posteriorly. Now, when we look at the medial end of the clavicle, we can see that it articulates with this part of the axial skeleton. It is called the sternum, and this specific part of the sternum is called the manubrium sterni. Now, we always want to learn more. As long as the clavicle is our subject, we want to learn more about it. It is the only transverse bone in the bones of the upper limb. It is curved bone. It has a medial end attaching to the axial skeleton and lateral end attaching to the scapula. It has two curves. It has upper surface, lower surface, anterior border, and posterior border. For your interest, the clavicle is the first bone to ossify in the embryo and has no medullary cavity. So let's collect data from these two images. Now, the medial end articulates with the sternum. It is bulky. It has more two dimensions than the lateral end, and this is what makes us recognize it very easily. And this medial end, from it, there is a curve that goes to the middle of the clavicle, and the curve is convex anteriorly and concave posteriorly. Then, as the clavicle continues laterally, it is going to be curved again, and the concavity is going to be anterior. Now, this is the lateral end. It is a little bit compressed and less bulky than the medial end, and it articulates with the acromion of the scapula. Now, looking at the inferior surface has rough areas for the attachments of ligaments. On the medial side, we have a rough area for a ligament called the costoclavicular ligament. It is, as its name indicates, it is a ligament that anchors the clavicle to the first rib. And laterally, on the inferior surface of the clavicle, we have also a larger rough area for the attachment of two ligaments. We will see these two ligaments in a while. Learning more about the clavicle. In the previous slide, we mentioned that the inferior surface has rough areas for attachments of ligaments. Now, this is the medial end of the clavicle, and it is also called the sternal end, and we have a depression with a rough area. This is for a ligament attaching the clavicle to the rib, the first rib. Now, on the lateral end or the acromial end, there is a larger area, also rough, for the attachment of the two ligaments attaching the clavicle to the scapula. There is a ligament called conoid ligament and attaches to the conoid tubercle, and there is a trapezoid line that attaches the trapezoid ligament. These two ligaments have names that describe them very well. It is always useful to write notes that came from our interpretation of images. Now, the clavicle has two ends and a shaft. What about the two ends? There is a medial end attaching to the axial skeleton and a lateral end attaching to the scapula. Now, the medial end is thick and rounded, and it is attached to the manubrium sterni, the part of the sternum, part of the axial skeleton. And the lateral end of the clavicle is flat in comparison to the rounded medial end, and it goes to the acromion process of the scapula. Now the shaft has more information. It is S-shaped curve, and this S-shaped curve has a superior surface which is smooth, while the inferior surface is rough for the attachment of ligaments. Now, the medial 2/3 is convex anteriorly and concave posteriorly, while the lateral 1/3 is concave anteriorly and convex posteriorly. So the curvatures are not equal in length. The medial curve is longer than the lateral curve, and there is no medullary cavity, and it is the only horizontal bone in the appendicular skeleton, and it is subcutaneous all over its length. You can feel it under your skin. Now, this image is showing me the ligament that attaches the clavicle to the first rib. And here is the joint, joining the clavicle with the sternum. And if you look laterally along the clavicle, you see that there is the first rib just inferior to it, and there is a ligament attaching the clavicle to the first rib. And here is another view of this ligament, which is called costoclavicular ligament. Costo means ribs or chest, and the clavicular for the clavicle, and you see anatomy is descriptive science. Now, we collected acceptable knowledge about the clavicle. Now, we want to have a look at the second part of the pectoral girdle made by the scapula. The scapula, as when we study the types of bones, is a flat bone, although it has processes here and there, and it is situated at the back, touching the posterior part of the chest, and it extends between the second rib posteriorly, and its inferior angle is at the level of the seventh rib. So this is the position of the scapula. This image has colored scapula green, and this is an anterior view of the upper part of the body, where you can see that all the ribs are anterior to the scapula, and it is attached to the clavicle and gives attachment to the humerus, and it has no attachment to the axial skeleton. The attachment to the axial skeleton is established by the medial end of the clavicle. I need more knowledge about the basics of the scapula. The question is, what is the shape of the scapula? Scapula, when we talked about types of bones, we said it is flat. And this flat shape is triangular. And a triangle has three sides and three angles. Here is the superior border of the scapula. This is the medial border. It has another name, and that is the vertebral border, because it faces the vertebral column medially. And this line marks the lateral border of the scapula. Now, here are the three sides of the triangle, and now this is what we see in the anterior surface of the scapula. It is the same in the posterior surface, but the anterior surface of the scapula is not having a feature, except there is a depression called subscapular fossa, while the posterior surface has some features. The lateral angle, it is a superior angle, and it contains several features. It is the busiest angle of the scapula. It contains the acromion process, the coracoid process, and the glenoid cavity. The glenoid cavity has an articular surface for receiving the humerus, the arm bone. Now, this joint, the scapulohumeral joint, is the point of attachment of the upper limb to the pectoral girdle. Now, what is the attachment of pectoral girdle to the axial skeleton? Now, this question, we already know the answer. And to remind you, the answer is the articulation of the medial end of the clavicle articulating with the manubrium sterni, the superior part of the sternum, which is part of the axial skeleton. Superior angle, it is medial, and it has not very significant structures. Now, the inferior angle is between the medial and the lateral border of the scapula, and it is pointed, therefore it makes the inferior angle. In this image, we will be learning more about the scapula. The figure to your left, where you can see the anterior surface of the scapula. Now, the scapula is described as flat bone. So it has mostly flat structure. And this is the anterior surface of the flat structure of the scapula. And this is called subscapular fossa. Now, when we discussed the bone markings, we said that we will learn these markings along the way. And so we ask ourselves, what is a fossa? A fossa equals a depression. Now, in this view, the lower left, we cannot see that this is depressed or not. But if we look at the upper image of the scapula, the lateral view, we can see that it is depressed. And This is a fossa, and it is called the subscapular fossa. It is also called the costal surface of the scapula because it sits on the posterior part of the thoracic cage. So this is the depression. This is the fossa, and it is most evident on lateral view of scapula, and it is a shallow cavity. And this is the story of subscapular fossa. Now, this is the same image of the previous few slides, and when we look to the left, we can see that the subscapular fossa has no other features than having a fossa, while when we look to our right, we can see that this is the posterior surface of the scapula, and there is a green area marked in this image. Now, what is this? It is a structure superior to the spinous process and occupying the upper part of the posterior surface of the scapula. What is the shape of this area? It is a depression. Therefore, it deserves the description of being a fossa. And this fossa, because it is superior to the spine of the scapula, it is called the supraspinous fossa, and it gives origin to important muscle called supraspinatus fossa. This is the best view where we can see the supraspinous fossa. The other two images, the anterior one and the lateral one, we see very little of supraspinous fossa, which is a view not telling us much. Again, looking at the scapula in three different views. Now, to our right, there's a view of the posterior part of the scapula. Now we know where's the spine, and we know that the structure superior to the spine is supraspinatus fossa, as we have just seen a few seconds away. And now we will look at the green colored part. Description of position, it is infraspinatus. The shape of this area is a fossa. That means it is a little bit depressed. So this is the infraspinous or infraspinatus fossa. It gives origin to a muscle called infraspinatus muscle. This image is showing the pectoral girdle plus the attachment of the upper limb to the pectoral girdle, represented by the humerus, and it concentrates on the posterior surface of the scapula. Here is the beginning of spinous process of the scapula from the junction of upper third and lower 2/3 of the medial border or the vertebral border, and as the spine of the scapula proceeds laterally, reaching the superior angle, it becomes the acromion process. And this spinous process divides the posterior surface into supraspinous fossa and infraspinous fossa. In this image, I can see the humerus articulating with the glenoid cavity of the scapula, and the green area is a small elevation inferior to the glenoid cavity. Is called infraglenoid tubercle. Now, a similar structure of the glenoid cavity and the head of the humerus, and I can see another green marked structure. This is also a tubercle above the glenoid fossa, which is called supraglenoid tubercle. These two tubercles they serve for attachment of muscle. Again, we return to the superior angle and is busy with several structures. Now we look at the green process. A process is a protrusion of bone. This green process is emerging from the anterior part of the superior border and the superior angle, and it is curved, and if we put an eye into it and a line, it becomes the head of a bird, and it is called coracoid process. If we look at the superior view in this picture, and it is a lateral photograph of the scapula, you can see that the coracoid process is projecting anteriorly, and this coracoid process is serving as a very good attachment for muscles and ligaments, and it looks like the head of a bird. And when you look at the posterior view, you can still see the coracoid process. This is an anterior view of the scapula showing the superior angle, and I can see very well the curved coracoid process, and it looks like the head of a bird. If you look lower down, go to the head of the humerus and lower part of the glenoid cavity, you can see a green area. This is a tubercle, a small elevated rough surface. This is called the infraglenoid tubercle. It serves as attachment of muscles. Now we will have a look at the superior picture, and we can see that the glenoid fossa is facing us, and there is a green area inferior to it. This is called the infraglenoid tubercle, and it can be seen also in the posterior view and anterior view. This is the lateral border of the scapula, and this is from the posterior view. This is a very simple part of the scapula being a triangle. Do you know what these green parts marked on the scapula are? Of course, they are indicating the inferior angle. I will leave you to conclude what is the name of this green part of the scapula. Mind you, it has two names. We have mentioned it in the previous slides. In this view, we can see that the person who made this view was concentrating on the processes that come out of the scapula. All these processes, they are concentrated in the superior angle, and you can see that the red one is the coracoid Now, what is the green one and what is the yellow one will be left to you to conclude, and they are written in the slide. This view is concentrating on the foci, the depressions present in the scapula, and there are orange, green, and blue three foci present in the scapula, and in addition to the yellow one, the one that has articulation with the head of the humerus. The slide is self-explanatory. I can see here the humerus, or the arm bone. It is a long bone. It is usually studied as there is an upper end, a shaft, a body, and a lower end. The colored part is what is called the head of the humerus. This is the part articulating with the glenoid cavity of the scapula. It is the point of attachment of the upper limb to the pectoral girdle. Now, I need to know more about the head of the humerus. The head of the humerus, basic facts are that, first of all, it articulates with the glenoid cavity. Then it is covered with hyaline cartilage. It is less than half a ball, half a sphere, and it is facing medially and upward to match the direction of the glenoid fossa. What is this? This is a photograph of the head of the humerus taken from superior view, and it shows the head of the humerus, and then to the right it shows that there is a constriction inferior to the head of the humerus, and any constriction inferior to a head is called a neck. Immediately inferior to the head there is a constriction, and we have just seen the constriction inferior to the head, and this is the neck of the humerus. Although this is a neck, it's a constriction below the head, it is called anatomical neck, because we have another area also named a neck, but it has a different first description. We will be coming to it soon. Now we know the head, and we are still in the upper end of the humerus, and we already know that there's a head and a neck. Now, if we look at this marked structure, and let's describe it. It is an elevation, a rather large elevation, present on the lateral part of the upper end. It is lateral to the head, and this is what is called the greater tubercle. Why the greater? Because there is another one smaller in size. Here is another component of the upper end of the humerus, and it is after the head of the humerus, the neck, the greater tubercle, and this is the fourth. It is an elevation, and the basic facts about this elevation, first of all, it is inferior to the head of the humerus, while the greater one was lateral, and it is anterior to the upper end of the humerus, and this is called the lesser tubercle. We are still in the upper end of the humerus, and the colored area is not the greater tubercle or the lesser tubercle. It is between them. Therefore, it can hold the name intertubercular. But intertubercular what? It is a depression, but we cannot call it a fossa because it is a long depression. That means it is a groove or a sulcus. Therefore, this is intertubercular groove or intertubercular sulcus. It is for a tendon to pass into this long sulcus or groove. When we go lower down the upper end of the humerus, there is another slightly looking depression or neck. This is called surgical neck of the humerus. Why is it called this name? Because the humerus is commonly fractured or broken at this point. Therefore, it is called surgical neck of humerus. This is a nice exercise for you to test your understanding and your knowledge. You need to name and find the relations between these structures: the blue one, the red line, the brown, the yellow, and the deep blue. After finishing with the upper end of the humerus, as a long bone, we go to the shaft. The shaft is the diaphysis of the humerus, and it lies between the upper end and the lower end, and there are not many features in the shaft of the humerus. Now, this is a view where you can find an anterior view of the humerus and a posterior view. It looks as if it is a straight bone, but there is no straight bone in the body. All bones are curved. If you look at a lateral view of the humerus, it is curved. The lower end is more anterior than the upper end. Probably the only feature of the shaft of the humerus is that there is a V-shaped elevation almost in the middle of the shaft, the lateral part of the shaft of the humerus, and it is for the insertion of the deltoid muscle, the muscle that makes the roundedness of the shoulder. Now we have reached the lower end of the humerus. This lower end is very busy. It has many elevations and depressions of different types, plus it articulates with the radius, the lateral bone of the forearm, and the ulna, the medial bone of the forearm. What you see as colored in green, it is what is called the trochlea. Trochlea is a structure where it is elevated on both sides and there's a depression in the middle. This is going to articulate with the ulna. Now, what is this rounded elevation lateral to the trachea? Now, this is a rounded shape, and it is going to articulate with the radius, and it is lateral, and it is called the capitulum. Then we can see the tip of this arrow. It is pointing at the upper end of the ulna, where you find a process that is called coronoid process of ulna. That is an elevation in the upper end of the ulna, and we will be seeing it another time. When this is the capitulum, then the capitulum is going to articulate with the head of the radius. Below the head of the radius, there is a constriction. Therefore, this structure is the neck of the radius. Then, lower down, inferior to the head and neck of the radius, we see an elevation. This is called radial tuberosity. It is for attachment of a muscle. Therefore, it is elevated and it is going to have rough surface. Do you know what is this structure marked blue with dots? Well, let us start analysis. It is the lower end of the humerus, and it is not on one side or the other. It is in the middle, and it has two elevated margins and a depression in the middle. So this is the trochlea. Where are we now? We are at the elbow joint, the lower end of the humerus, and you can see upper end of radius and ulna. And when we look at the area marked green, it is superior to the trochlea, and it is a depression, and therefore it is called a fossa. Now, fossa is not enough. Fossa for what? It is called the coronoid fossa, because when we decrease the angle between our arm and the forearm, the coronoid process of the ulna is going to come and sit into this fossa. If there is no fossa, then we cannot flex our elbow joint. I'm sure you are familiar with this area, and we are concerned about the green marked structure. Where is this? Is it lateral or medial? The answer is it is lateral. Lateral of the lower end. And lateral to which specific structure? This is lateral to the capitulum, the ball head structure that articulates with the radius, and it is called lateral epicondyle. This is a term very well descriptive of the structure. Epicondyle means around a condyle, and the condyle is a large process, and it is lateral around a condyle. Lateral epicondyle. Here is the humerus, and we go down the lower end of the humerus, and we can see that there is a green marked area. Now, when we want to analyze where is this area, we can see that it is on the lateral side, just above the lateral epicondyle we have just seen. It is an elevated, long, bony structure. Therefore, this is going to be called lateral supracondylar ridge. Why lateral? Because it's on the lateral side. Supracondylar, that means it is superior to the condyle. The condyle here is the capitulum, and it is a ridge because it is a long elevation. Now, this is the lower end of the humerus, but it is a posterior view. We cannot see the capitulum. Capitulum is an anterior structure, but the yellow name is indicating that this is a lateral condyle, and it is lateral, and we cannot see the condyle because this is a posterior view. If we look at this image, we can see that there is capitulum just under the red circle, and what we want to do is to compare it with the medial epicondyle. The medial epicondyle is much larger than the lateral epicondyle, and you can feel it under your skin on the medial side of your elbow joint. Of course, we are looking at lower end of the humerus, and we can see the blue area here. We have just seen what this structure is, and it is the medial epicondyle. We know why it's medial, and we know why it's epi, and we know why it's condyle. The question is, where is the condyle? The condyle is the trochlea. Trochlea is just lateral to this area, and trochlea is this, the forearm, and it is going to sit inside this fossa. If there is no fossa, we cannot straighten our arm and forearm. Which bone is this? This is the ulna, the medial bone of the forearm. It's a long bone. It has an upper end and a lower end. The upper end has several features. The lower end has minimum number of features. Now, the upper end has this blue marked structure, and this is called the coronoid process of the ulna. And when we flex our elbow, decrease the angle between arm and the forearm, this olecranon process is going to enter the olecranon fossa we have just seen. Now we know which bone is this. It is the ulna, the lateral bone of the forearm. Now we have seen the olecranon process, we have seen the trochlear notch, and in the last slide we have just left, we have seen the coronoid process. Now, just posterior to the coronoid process and medial as well, we can see a depression for the head of the radius to sit in. Therefore, this is called the radial notch of the ulna, for the head of the radius to articulate with. Where are we now? We can see two bones. The bone that is the longer one that has a curved upper end. This curved upper end, you know what, this is the olecranon process of the ulna, and the notch in front of it is the trochlear notch where the trochlea sits, and the black arrow is pointing at the radial notch. This is the place where the head of the radius is going to sit in. Which bone is this? Of course, you know now, it is the ulna. We looked into the features of the upper end, which were the olecranon process, the trochlear notch, the coronoid process, and the radial notch. We go down, the lower end is smaller than the upper end, and there are not as many features as in the upper end. In fact, there is a little process marked blue here inside the red circle, and it is called the styloid process of the ulna. Which bone is this? This is the radius, the lateral bone of the forearm, and this long bone has smaller upper end and larger lower end. The upper end has three features. The blue marked area is called the head of the radius. Now there is a constriction inferior to the head, therefore it is called the neck of the radius. This is a closer look at the upper end of the radius. This upper end is going to articulate with the capitulum of the lower end of the humerus, and medially it is going to articulate with the ulna. The head will articulate with the radial notch of the ulna. The top part is the head. The constriction under the head is the neck, and the marked area with the white arrow is radial tuberosity. Radial tuberosity is medial, and it is serving as attachment of a muscle. Which bone is this? This is the radius. Can I give you reasons why this is the radius? First of all, it's a long bone. Then at the upper end it has a head, a neck, and a tuberosity. And as you come down, the lower end is larger than the upper end. Although the upper end has three features, the lower end has a single feature, which is called the styloid process of the radius, and it is marked blue inside the red circle. You may ask, well, I have heard of the styloid process a few minutes ago, and it is in the lower end of the ulna. Is this right? The answer is yes. Lower ends of the ulna has a styloid process, and lower end of the radius has a styloid process. Distal to the lower end of radius and ulna, we have the wrist area. having the wrist joint. Is it one joint or several joints? The answer is it is made of several joints between bones. Why I am saying bones and not bone? Because the wrist is made of 8 small bones, 8 short bones. They are arranged in 2 rows. Each row is made of 4. They connect the forearm with the hand. Now, each one has a different name, and I will explain to you an easy way to memorize these names. Here is one of the proximal row marked red. It looks like a boat, and it articulates with the lower end of the radius. Why this is lower end of the radius? Because it is expanded. This is scaphoid. The scaphoid bone is the most frequently fractured bone of the wrist. So I know it because it articulates with the radius. Now, when we move medially, there is this red marked bone. It articulates with the ulna, and this is the lunate. Triquetrum and pisiform. Then now we go to the next row. Here we have a carpal bone that articulates with the thumb. It is the trapezium. Let's say that the thumb starts with a T and trapezium starts with a letter T. So I know this trapezium because it articulates with the base of the metacarpal of the thumb. Next is this red marked carpal bones. It articulates with the index finger, and this is the trapezoid, because if you look at its borders, it has 4 borders in the form of trapezoid, and it articulates with the index finger. Next is this red marked bone. It is the largest of the carpal bones, and it articulates with the longest middle finger. Therefore, it is called capitate. The capital of any country is the largest city in that country. Therefore, this is the largest carpal bone, and it articulates with the longest finger, the middle one. Then we have this marked red bone, and it articulates with 2 fingers, the ring finger and the little finger, and it has a handle. It is here drawn as a circle on top of the body of the hamate. This is like a hammer. Therefore, it is called the hamate. These green marked bones, there are 5, articulate with the wrist joint, the carpal bones, and they connect the carpal bones with the fingers. These are called the metacarpals. They are long bones. There are no special features for these bones except proximal end, shaft, and distal end. Then we have the beginning of the phalanges, and the first ones are the proximal phalanges. Look at the thumb. The thumb has 2 phalanges, while the other fingers have 3 phalanges. So this is the proximal, and these are the middle phalanges of the fingers. And note that the thumb does not have a middle phalanx. And the distal phalanges, they are also long bones. You may be surprised and you suggest that these are short. No, they are not short, they are long, because one dimension is at least 2 times the other dimension. So all these are long bones. No special features. Now, this is the end of this PowerPoint presentation. Now, you have a group of images after the end of the presentation, and these are for you to exercise commenting at and name them and see their relations.